Thanks again for everyone for being here today for the June 2nd edition of the Cross Canada Checkup. Now, we've been doing these webinars since March 22nd, I believe was the first webinar that we launched, and really the idea was to stimulate discussion and keep people informed on COVID-19 and issues surrounding the profession, and really share the research, resources, and experiences that people had, especially physiotherapists, in dealing with COVID. And we started by doing them 3 times a week, and then we went to 2 times a week, and one of them was picked up by the CPA. So thank you to the CPA for picking them up. And this, I'm sad to say, this is our last episode, but I'm excited that we have Jon here, who's going to be ending it with a bang. So we have a great guest speaker to end us off here. So I would just like to thank our speakers throughout the last few months who've been coming on and sharing a number of different topics and really stimulating discussion, as well as the CPA for hosting these events on Tuesday, and really all of you and all of the members and listeners who've been coming in and sharing discussions on these sessions on Tuesdays, but also the ones we've been hosting throughout the weeks. And really I think it's been useful in terms of stimulating discussion and really getting ideas out there and helping to drive our profession forward. So thank you, and we will be continuing to do something in the future, but we're just going to figure out exactly what that is, and we'll keep you up to date on that. And we will be continuing with the Thursday sessions, which is more of a journal club edition. So now, before I do pass it off, I just wanted to offer our support to the Black communities in Canada, as well as the United States, and around the world, and really any group that's experiencing racism, prejudice around the world and in Canada. And I just wanted to take a note to thank the CPA and thank Vivi for putting out a statement to commit to including social justice within the CPA, as well as Indigenous representation. So just wanted to mention that, and thank you to the CPA for doing that. So Mike, off to you.
Well, thank you, Phil. And yeah, we'll probably end today's session with a
Mike, we lost you.
Am I back?
You are back, yeah.
Okay, I'll just turn my video off for now. So yeah, we'll end today's session, the finale, with a little bit of a view of what we're going to do into the future. But for the moment, and it'll be my more than my honor in a few moments to introduce Jon Warren. But I am going to show a few slides here. So I'm just going to share my screen. This will be my last chance to provide what we've been calling this SITREP, or situation report. So I just want to, this is the one that's dated from today from WHO. You can kind of see some of the numbers. So from a global perspective, these are the numbers of cases now, and then you see on the right-hand side deaths. Fairly, aggressive numbers there still. So when we look at the global map, the dark, obviously, maybe at this point, the darker the country outline, the more cases. You may recall that we all started in this region about 5 months ago, and now this is our picture where the hotspots really have become the United States, and coming up very quickly, sadly, is Brazil. And in a moment, we're going to be talking a little bit about New Zealand, which is now coming in with, I think, no cases, or at least only one confirmed case. And Jon will unpack that for us a little bit. So this is the picture. Now, just for interest's sake, I thought I might go back to this earlier situation report dated February 2nd, so effectively 4 months ago. Here were the global numbers 4 months ago. Global 6 million. You can see the deaths that are outside of occurred inside of China. Now, forget the validity of some of those numbers, but there they are. You can kind of go through this report and see some of the numbers here, and I just want to show it to you. These are the areas with reported cases. So in, as you can see there, in Canada, 4 months ago, there were four reported cases. So this just speaks a little bit to the veracity of COVID-19. Now, again, I'm just because it's my last chance to do this. So this is where you find all these reports. You'll find it on WHO. You go to coronavirus situation reports, and you can kind of look through them all right here. It's a real fantastic data source. Now, thinking a little bit more about Canada, here is our situation, and so this is a live bit, so maybe for John's sake as well as many who may not have been here last week, but this is the kind of, so if we look at British Columbia, for instance, if we look at Alberta, you see the way the curve definitely flattens out. If we start moving from west to east, you can see sort of this flattening until you get again to Ontario. You see that curve, of course, or in Quebec, where we're seeing still not even close to a plateau of the numbers. Yet at the same time, the economies are well into the opening movement now. The East Coast has a different viewpoint, a different perspective as well as in the north up here. So if the United States and Brazil become the hotspots in the world at this point in terms of number, in Canada we are looking at Quebec being double the size, double the numbers of Ontario. So what I'll do is I'll stop sharing and I'll attempt to open my my video here. So that's a little bit of the situation report. Our numbers are well above 6 million. You know, actually I forgot, Phil, that we used to do these 3 times a week, and in each of those events we would see the numbers not just double but quadruple. So here we find ourselves. Some countries have done very, very well, and one of those countries is New Zealand. So I had the chance, so I reached out to Jon Warren, who is a past president of the New Zealand Physiotherapy Association. It's actually not called that, it's called Physiotherapy New Zealand, I think. Correct me if I'm wrong there, John.
That's it.
And spent a long time in regulatory authority world, many years, and he'll tell us more about his story teaching here in the United States. He's a global traveler, but has a wonderful family, but more than anything is a really good mate, and secondly, really cares about what happens to the profession, and has demonstrated that time and time and time again. So we're really proud to have you here, John. I'd like to pass the floor over to you, maybe to give a little bit more background of kind of who you are, what got you to this point. And then really like to listen a little bit more of your experience as a physio working at an assessment center right there in New Zealand, where the economies are starting to open. I will note that New Zealand, again, is one of the countries that has a woman leading the country. So I don't think that's by chance of how they have managed so well, because I'm kind of making a joke, but I'm actually serious. I think leadership becomes incredibly important. We're seeing a dearth of leadership around the world as the events from the last few weeks here in America have unleashed tensions and violence. Leadership is important, and what we have here today is Jon Warren, who's one of the great leaders of our profession. So John, I'm going to pass it over to you. Thanks so much for being here, and the floor is yours, my friend.
Thanks, Mike, and appreciate the introduction. A little bit over the top, maybe, but I would have to say it's been a lot of fun working with you over the years, and I appreciate your friendship and your global vision. But I suppose if I firstly, I should say kia ora, which is Maori for hello, and bonjour. See, you've got 2 languages as well, and hello. And Probably the other one is we've got a national language, which is New Zealand Sign Language. So I'll say hi. So we've covered our bases here. I joke that I graduated from physiotherapy school, not just last century, but last millennium. But looking at you, Mike, I think I'm faring better than you. See, I'm so much younger looking. But anyway, that was at that stage, New Zealand had 2 physiotherapy schools, and I went to the one that was the original physiotherapy school, and that was in Dunedin, the Otago Physiotherapy School. And initially, I worked in public hospitals and Burwood Spinal Unit, and I was a very keen skier, and the lure of skiing actually attracted me just to work on the slopes and ski rather than do physiotherapy. And as a sign of the times, at that stage in the 80s, I made more money skiing than I was making as a physiotherapist. But hence that actually took me to the great country of Canada, and I ended up working in Vancouver for 3 years and skiing at the Whistler Ski Resort, which for those of you that haven't been there is worth a visit. And so I worked in the public sector and private. So I did a bit of musculoskeletal work in Vancouver, but worked in the British Columbia Children's Hospital for 2 years. And I think I was the first male physiotherapist in the Children's Hospital in Vancouver. I did a stint then working in London, and then came back and set up a partnership in a physiotherapy private practice. So I did about 20 years there, looking after, mainly specializing in sports medicine. Along the way, as Mike alluded to, I've done a lot of work with the association and ended up being president for 4 years. It was at the end of that I thought it's time to break out, and went traveling again, and that resulted in, after a stint in Ireland, working in San Diego at the University of St. Augustine, which was, for those of you that know Stanley Paris, it was set up by him and had 4 campuses across the country. I think it's now got 5, I think, with designs for more. So an interesting model, and it was an interesting place to live, and fascinating. When I lived in Canada, I thought, yeah, there was a cultural shift from New Zealand to Canada. And I thought, yeah, I won't be surprised when I went to the States. But I was surprised. Quite different culturally. And for some reason, they didn't understand my sense of humor. I'm not sure what that was about. But anyway, I've got some slides because you can get sick of looking at me. So let's see if we can find this PowerPoint. And here we go. So this is Wellington on a good day. And this was Mike when he came to visit. Didn't like wearing clothes. And this is what actually Wellington looked like for a great period of time through the COVID crisis. Nobody around, of course. If we go on to the next slide, I'll find it. Just for those of you that don't know New Zealand, tiny little place at the bottom of the South Pacific. Got 2 main islands. This one here, if you can see my cursor, is the North Island. This is the South Island. There's Stewart Island. They're the 3 main islands, and there's a scattering of small islands around. The population is only, just tipped 5 million. And there's certainly, as I'll talk about it as we go through, advantages of being in an island in a pandemic. So population of 5 million. Down here, just in here, this is Wellington Harbour here, and this is Wellington where I live, and that's the capital of the country, known for its windy Wellington, due to this thing, Cook Strait, just here. If I just move to physiotherapy, we have 5,500 physiotherapists in New Zealand, and of them, around 58% work in private practice. So it's an interesting demographic, with only 26% working in public. So that's New Zealand. If we then have a talk about COVID, one thing the government did very well here was the branding, if you like, of this pandemic and getting the messages out. So here you can see this was the main message: unite against COVID-19. And then you can see on the left of the screen, it's in Maori. And when this started to break, as Mike showed with the world figures, the New Zealand figures were interesting. So I'll just click through, and if we have a look here, you can see, I'll just come down here to the numbers. So if we see cases over time, and we'll just bring that up a bit bigger, we're looking at about 28th of February, one case. So if we then zoom to, I think the 17th of March, we had about 17th of March, things started to get exciting wherever that is. So we had 3 cases on the 17th of March, and that's when our health system was gearing up to cope. We were then looking at, sorry?
Can I interrupt? I'm not sure if everybody sees, I think when you click that, it goes to a different screen. So you might have to share a different one of your screens that gets
open. Okay, hang on, good point. Let's go here.
The fact that I had to talk about technology should tell you something.
Yeah, that's good. Let's see. I'll find it. Perfect, got that now. Can you see that, Mike?
Yeah, we can see that.
Perfect. So now you can see the flattening of the curve. And you can see if we go back to around here, 7th of March, only 5 confirmed. So our country was gearing up. Some interesting figures. We only had 153 intensive care beds in New Zealand, nationwide. We had the space for 80 more. And if we get up, we had 231 that could be used for ICU that are outside the ICU, what is being used as the main ICU rooms. The capacity at the beginning of March was somewhere around 520 ventilators. So you can see we have a health system that is a good health system, a lot like Canada. There is a national health service, a public health service that works well. So if we go to the 20th of March, we then had 39 cases in total. And then on the 21st of March, that's when the government, Jacinda Ardern, as Mike alluded to, our female Prime Minister, she introduced a 4-level alert system, which meant work from home, physical distancing, high risk to stay at home, and to basically stop non-essential travel. So by the 22nd of March, we're now up to 66 cases. And on the 22nd of March, we moved to level 3, which was restrict non-essential business. So all non-essential businesses were closed. All events and gatherings were cancelled. There was no travel between regions. And schools were closed except for essential workers' kids. So that's on the 22nd. By midnight of the 24th, we're into a full lockdown. And by the 24th of March, my birthday, Mike, note that down, please, we had 155 cases. So if we go up here, you can see somewhere, come in, doesn't want to move this cursor. We peaked at around 1,500 cases, okay? So you can see, as our Prime Minister said, we're moving now. Like Italy, they had 100 cases once. So when everyone worried that, we closed down all international travel, you weren't allowed into the country, when we're in level 3, anyone that came into the country had to be in self-quarantine. And then when we went to level 4, everyone was put into mandatory quarantine. So the government put everyone in hotels where you were stuck for 2 weeks. I'll just go back to my screen and I'll just share my, where are we, my PowerPoint. Right, so if we move on, as I said, the messaging was funny and it was quaint. If we bring back the classic of what our culture is, be kind was everywhere. And it was interesting. I was talking before we came online, and rather than have a rush on guns like the Americans did when they went into lockdown, the Kiwis had a rush on bicycles. And in my area where I live in Wellington, it was interesting. This whole physical distancing was really difficult because there were so many people out walking. Every morning you'd see the same people out walking. But what was nice was there was no traffic. So everyone just walked on the roads because there was no cars going at all. So that was really interesting. And the messaging was brilliant. Every day there was a press call from the Prime Minister and from Ashley Bloomfield, Dr. Ashley Bloomfield, who's the Director General of Health in New Zealand, who's become quite a legend. He has a fan club now. They've written songs about him. And he was this guy who was completely unflappable. He's got great credentials, worked at WHO in Geneva for a while. And basically our legislation says in the time of a global pandemic, he's in charge. So basically, he was telling the government what to do, and it was pretty amazing. So if we have a look here, this is New Zealand and the spread. You can see that Auckland, which accounts for over 1 million people, so of 5 million in the country, 1 million are up here in Auckland. They had most of the outbreak, but you can see an interesting thing like Hawke's Bay, which is from where I'm from, 44 cases, which is a lot if you look at the rest of the country. And that was because a cruise liner stopped there and stopped off, and all these foreigners got off and nicely infected the local population there. So if we fast forward to June the 1st, you can see, here's our total. We had 1,504 confirmed and probable cases. And as you can see, one case was active, and I think there's no longer any cases active in New Zealand. Interestingly, the 22 deaths, I think, if I remember correctly, all of them are over 60, and I think the majority are over 70. And unfortunately, one rest home accounted for 12 of those deaths. So again, it just shows how rampant that virus is when it takes hold. So what did I do in the COVID crisis? I was working at a centre just like this in Wellington. So they asked for people that would be interested in working on the front line. So it was a no-brainer for me. This was just down the road, about a 20-minute walk to Wellington Hospital. And right next to Wellington Hospital is Newtown School. So they set up a drive-through at Newtown School. And what we had was we had a national health line. So people would call Healthline if they had any symptoms. And Healthline would then book them into the local COVID centre. So one thing the government did very well is they said there's one thing that we have to do, and that is test, test, test. So I think we had one of the highest rates of testing per head of population in the world. And so what we did was really, we had all these people booked in, which was nice. We had all their details. We'd go and do history checking, check their symptoms. And having them self-contained in a car is very easy to limit the transmission. So as soon as they came on the site, they were all, any occupants in the car were given masks. As they drove through, they were registered, and then we did a history take to make sure that they conformed to the case description. As they drove around to be swabbed, it was kind of interesting. I'm not sure what swabs you're using in Canada, but we started off with nasopharyngeal swabs, which one swab goes quite deep down the nose, of course, not exactly comfortable. I'm not sure whether we ran out of them or whether it was just easier to access the oronasal swab. So we're doing 10 seconds at the back of the throat, 5 seconds each side, and then 10 seconds down the back of the nose. And then that was put in the swab container, had a sticker on it, sent off for testing. The process was the lab generally would get a result within 48 hours. If people were negative, they would text that result. And if they were positive, they would got a phone call from the contact center to look at contact tracing. The people that were negative, what we were instructing them was, because of false negatives, to ensure that they stayed isolated until they had 48 hours without any symptoms. So as soon as anyone came in the centre to be tested, we said to them, from this point on, you have to consider yourself active with COVID-19. You're not to go out, you're not to go to the supermarket, and if anyone's coming to your house, they drop off supplies, food, that sort of thing. And the only time you can go out is if you do physical distancing to go for a walk, but do not get in contact with anyone else. And do not think that you are safe and the population is safe until you've had 2 days without symptoms. We did, which was kind of interesting, which has been shown worldwide, had people without symptoms that were coming back for retests and still testing positive. So interesting thought on, are they still transmitting virus at that stage? We have one person that had 3 tests until they came back on the 4th test to be negative, and yet had had no symptoms for 2 to 3 weeks. The conversation and discussion around that was, it was probably really low strain, so it wasn't likely to be transmitting at that stage. If we look at physiotherapy, what happened with that? I told you the stats of, we have over 50% of the profession in private practice, and that's because we have a nationalised crown entity, if you like, insurance scheme called ACC. It's the Accident Compensation Commission. It is such a good scheme. It hasn't been replicated around the world. Not sure what that means, but if you have an accident, be it a motor vehicle accident or any accident of any sort, playing sport in the workplace, you're covered. There's no suings. The insurance scheme covers all medical costs, including physiotherapy. Sometimes there's a co-payment, but you can't sue for costs for your workplace, for motor vehicle accidents, or anything else. So it's a nationalised scheme. Just for your interest, they get their money from a levy on fuel, from a levy on registration of cars, from a levy on employers, and from the government, who pays for those non-work, non-motor vehicle accidents. So what they did, which was quite interesting, they'd started off paying for telehealth, and then when we went into full lockdown, they said they'd pay for all telehealth. For anyone that had an appointment with a physiotherapist, they would pay the same rate as face-to-face visits, which was very cool. So, and prior to that, they'd been quite limited in terms of what they were allowing. They were only allowing follow-up telehealth to be paid for, and I think it was on a 15-minute rate level. So they said with the lockdown, they would pay for anyone that needed telehealth, and they'd pay it at the same rate as face-to-face. So there's an interesting piece of work saying, okay, what are those outcomes like in lockdown, out of lockdown? How does face-to-face compared to telehealth outcomes? So there's an interesting piece of work. So watch this space. And at the moment, now that we're in level 2, they're thinking that we'll go to level 1 next week. So level 2 means that physiotherapy clinics have reopened. You're allowed gatherings up to 100 only. Of course, our borders you still have to give dispensation to get back to New Zealand. I had a friend that wanted to come back for their grandmother's funeral, and she lives in Australia. No, can't get back. If you come back to New Zealand, if you can get into the country, if you're a New Zealander, you still have to do a mandatory 2 weeks of quarantine. So that's still the case. So, of course, if you look at things like our national airline, Air New Zealand went from 100% loading to less than 5%. And it still has only got a handful of flights going internationally each week. So physiotherapy, you can go, but they have to do PPE for their face-to-face contact. So again, it's still quite limited there. When we go to level 1, it should be easier. We should not have the issues with PPE. SEAM, we've had, I think, 10 days of no cases. So it looks like at the moment we've beaten this in New Zealand, and the risk is people coming from overseas. So during lockdown, I did a lot of walking around the hills and running around the hills. So there's just a shot to finish of this is Island Bay down here where I live. Okay, I don't actually live in the water, of course. Thanks, Mike. I knew you were going to say that. This is the walkways. There's lots of green space around the hills of Wellington, including some beautiful Maori sculptures. And this is Wellington Harbour here. And yeah. We're now rowing ourselves to a better place, hopefully. That's me, people.
Jon, thank you very much. What a great sort of description of how things have unfolded. And I'm going to ask a question, and I'll encourage everyone else, if you have questions, go to the Q&A on the bottom, or the chat. We'll figure out the two. But okay, so New Zealand has 5 million people. Numbers were relatively low-ish in general. The curve flattened very quickly. And now sort of there's a recovery period. I think up to 100 people can actually gather. I saw this somewhere. And so when a New Zealander, when a Kiwi has a look at this and sees what's kind of going on elsewhere, and I don't mean to be political.
Oh, Mike, we're losing you just as you're starting to get political and saying you're not.
Yeah, you can't. You got me now.
Yeah,
you got me now.
Yeah.
Yep.
Yeah. So you can't. For instance, you can't compare New Zealand to the United States. 5 million versus 345 million. But when New Zealand looks at this, how do you kind of like write this whole question of infection and prevention and addressing early onset of some of these symptoms? Like how do you, like, what's the news feed in New Zealand talking about the North American experience?
Well, just going to that, I'd just like to acknowledge, Phil, your message, the Black Lives Matter, and I think that's really important. And we have issues with unconscious bias and racism in New Zealand. And it was interesting that 2 days ago on Monday in the pouring rain, they say over 500 people were at a rally at 6 o'clock at night outside Parliament in the pouring rain. What is interesting is that was over 100 people and there wasn't physical distancing. And the Director General of Health did say, well, the chance of transmission in the pouring rain and cold is not very high, and there's no community transmission, so we're right. But getting back to your question, Mike, I think the interesting thing with the New Zealand population is we probably respect authority a little bit more. That would be one thought. I think also, to give the government their dues, the messaging was very good. It was everywhere. And it's kind of very provincial, if you like, that the message, be kind, was reinforced all the time. Be nice to other people. And, sometimes when you get these huge lines outside supermarkets with the physical distancing, it's just one of these things. And what was kind of nice is people having a nice chat, and it was very respectful. And the 1 o'clock news feed from the Prime Minister and the Director General of Health had huge viewings, just huge. So I think they put the message out really well, and particularly about your own personal health. And what, New Zealand was lucky in that because we're a little island in the middle of a bunch of islands in the middle of the South Pacific, we have really good international news. And we could see how bad it had been overseas. So it was a no-brainer. When we went into lockdown, Italy was rampant with people dying, with their health system being completely overloaded. So that's why I gave you those stats. We only had, 520 ventilators at one stage. A very small amount for 5 million people if this virus had gone rampant. Does that answer your question, Mike?
Yes.
I know it was a loaded question.
Yes, it did. Thank you. I'm going to ask the first question, and then I'll get Phil to look at the Q&A. But so Sean Cleaver asks, to what extent were isolation practices considered voluntary as compared to those that were enforced somehow? So, yeah.
I suppose that's a good question. So when we're in level 3, they said, okay, anything non-essential, don't do, go to the supermarket. And basically they highlighted level 3 with the thought they were going to level 4 2 days later. So there was a mass run on shoppings, on garden centres, I should say, building supplies, because people went, we're going to be in lockdown, we're going to do the whole DIY. So, the garden centres ran out of plants. It was just hilarious. Paint shops just ran out of paint. So people, I think are pretty pragmatic here. They thought, yeah, okay, well, if we're going to be in lockdown, we will do it. And the police said they'd enforce it. There were some people that basically flouted it. It was interesting. I've got a little 1985 Fiat Abarth, my little toy, and I was driving it with my daughter. We just went to basically turn the engine over and make sure the battery wasn't flat, and the police pulled us over. And I thought, hello, this was in the middle of the lockdown. And I'm not quite sure why, but as he walked up to the door, he said, oh, okay, I see you live in Island Bay. When you drove past, it came up that you lived in Hawke's Bay, which is about 4 hours away, and we were wondering why you were out of the region. So it was being monitored, and generally warnings were being given. When we were in level 3, people were still out surfing and fishing, and they said, hey, look, we don't want you to be doing anything which might need emergency services. So surfing, fishing, all that sort of thing. Mountain biking was told don't do it. But they did say, yeah, for mental health, and they did stress mental health, it's important that you can get out and exercise, but be very careful about physical distancing, washing hands. All the shops had hand sanitizers at the front door and at the back door. So you wash your hands going in and wash hands going out. So hopefully that answers that question.
Yeah, great. Thank you. So there was a question you mentioned a few times around messaging from the government. Now there's a question from Diana Hopkins-Rosseel who asks whether the messaging was by province or it was centralized more federally or nationally.
That's a good point. So we don't have a federal system. So one country, one voice, one branding, really easy actually. So I think comparing it to Canada and the United States and even to Australia, which have federal systems, makes it a little bit more exciting to keep the brand on message. But in saying that, small country, 5 million people, so yeah, easy to get the brand out, and it was projected really well.
Yeah. Okay. Thank you.
And I'll just say, John never, when I ask a question, John never says that's a good question. So I just start with that point. There are 2 other questions here. Combine Ariane's and Sandy's. So Sandy says, John, what happened to most of the private practice physiotherapy clinics in terms of government support, like wage support, and how has New Zealand handled the reopening of outpatient services and clinics, like, the phased-in approach? It's been a contentious issue across Canada. You might not know, some provinces have allowed physios to go, others delay, so it's not a national scheme. So over to you.
Right. That's a good question.
Yes, of course that's a good question.
I'll start with the last part. So the phasing in of the clinics getting back to work, really, one Ministry of Health in New Zealand, they put out guidelines and they say this is what has to happen. To give the Physiotherapy Board, they've also sent messages to all the registered physios in New Zealand. If you weren't getting on the Ministry of Health website, you'd certainly get a message from the Physiotherapy Board, which is the regulatory board. And then, the Physiotherapy New Zealand were informing you. So you really weren't stuck for, at one stage, it's like, wow, we're getting so much information sent to us, whereas you can just go to the one website and find it out. So the first question, so what the government said was it would pay up to 80% of all employees' wages weekly, and to a threshold. And I can't remember what that threshold was, to a certain amount. So yeah, billions were given out straight away when we went into level 4 lockdown. And really, my wife applied for it. She put in and just had to put, who she worked for, what she normally gets paid, and 80% came through really quickly. So they really came up to speed fast.
Thank you.
Then I'll go to, so Sandy, Rennie had a question, and you kind of, you answered this a little bit in your last question. Was the subsidy that you were talking about, was that for everyone, or was that specific for physiotherapists? That's
across the country. For everyone across the country. Anyone that wasn't able to work, okay. You got a subsidy, and that subsidy was going till mid-June, I think. So even so, we'll be well out of lockdown, and I think they've extended it as well, parts of it, depending on what sector you might be working in.
Okay, great. So thank you. So Sandy Rennie, who's a board member of the Canadian Physiotherapy Association. So he asks, so Jon, what happened to most of the private practice physiotherapy clinics in terms of any government support? So as an example, like wage supports.
Yeah, so they all got wage supports, as I've just intimated, really. And the ones that really were doing a bit of telehealth right from the get-go got up and got into it quite quickly. So some adjusted to that really well. And I think there's a real lesson there is when we see these things that are in the future and we go, oh, that could be a good thing, is not waiting until you have to. Proactivation is better than being reactive, because we know the power of digital health. And really, we've got to go, okay, let's get out there. And I think, the challenge to the profession worldwide is let's get some research to show this works, because there's no doubt hands-on treatment is effective, and there are very specific times that it's really, really effective. But at other times, I think, we've got to go, we can do so much more just from transmitting the message and showing people.
Yeah, absolutely.
So
I have a follow-up question to that is, in terms of when you mentioned that there was support for telehealth, was that something that the association was really advocating for, or was that something that was just provided by the government without question or real need for advocacy?
No, there's always need for advocacy.
Yeah, I figured.
No one's going to hand out money and just say, here, have it, because it seems like a good idea. Having been in that experience a lot. I would say what they've been doing, the ACC particularly, has been dipping their toes in the water and going, there is a bit of research around the world. It seems like a good idea. We'll allow it for certain situations. And I've done a little bit of work on digital health, and, to appreciate it's really good for remote and distance populations, but there's a risk also that we're actually increasing the divide, and we're just applying it to people that have the technology. And so the caveat is we've got to make sure that when we apply digital health, it actually goes to people that need. In this case, when you have a lockdown, everyone's at need. And I actually had a plumber, unfortunately had a water main burst, just a little bit, not too much damage last week. So the plumber came and he said he went to his physio via telehealth, and it was really good. She explained some exercises and went through them over the computer, and it was really effective. And he said, although he's got an old pretty shagged knee, I think he said. He said it's now able to be used with very little pain. So, you know,
Nice.
there's a good anecdotal evidence. These things are good.
Yeah. Okay, great. Thanks.
But let me come in with two questions at once, it's basically from Ariane and Victor. So Ariane asks, how do you see physical therapy changing post-COVID in New Zealand? So, you know, practice and patterns. But that links also to something Victor asks, which is around, you know, when we move to online, how do you truly evaluate pain, maybe dysfunction, you know, subjectivity of symptomology? And now, so that's really the question. But before you answer, I'll just say to everybody online, Jon is really his specialization is in orthopedics, and has spent years. When I first met him, he just came off working with the All Black in New Zealand, and it was. So I think he's got a fair amount of experience which will enable him to answer this question. So Jon, over to you. And I know it's an excellent question. I know, of course it is.
Okay, yeah, thanks. I have worked a lot with professional rugby. The All Blacks, not so much. I did spend some time with them, but not a lot, just to put that rider in there, Mike. I think it's a really good question of where we go. And I don't think this question is limited to New Zealand. I think, you know, we're limited by what we see in front of us at the moment, in that it's easy for people to walk in the door. Face to face is brilliant for your initial assessment. There's no doubt that getting to know somebody is a lot easier when they're in front of you. We can all see the challenges of technology. You know, mic freezing is sometimes a good thing, but it doesn't actually help communication. And so that's why, you know, building that rapport for your first face-to-face, I think it's great. I think in terms of, like anything, it's always the golden rule. He or she who has the gold makes the rules. So you need to actually convince funders. And that's where we need to get out there and get that research to show that this works. And if we rely on, you know, the funding coming first, I think, you know, we're always going to be a step behind. What I've seen and what I've experienced in terms of telehealth is, yeah, you can get people to move their limbs. You can appreciate range of motion. You can even measure it on the screen if you want to. In terms of your subjective skills, you know, it's not ideal doing it online, but it's still doable, very doable. So I think, you know, the challenge is we need to start getting some data, and we need to start getting clinics to aggregate their data so we can use this for advocacy for funders. I think we're only limited really by what we can see really in the future. I'd say that there is a lot more scope for digital health than we're even thinking at the moment. Did that cover all the questions? Because I know you like to ask me 2 or 3 at once, Mike.
So they're always loaded for you.
Yeah, exactly.
So as Phil is getting ready to ask, I see there's Lisa and Sandy, there's a few questions. So as Phil is getting ready to ask those, I'll just say that in New Zealand, you have Dave Nichols there, who's doing some interesting work around critical physiotherapy and really thinking, what does all this mean? So how do we maybe use this event as a stimulus for change? And I just mentioned when I was speaking to one of the private practitioners here in Ontario, as the space opened to see patients, a lot of PTs have now sort of either seriously reduced their tele-rehab services or completely eliminated it and gone back. So I think that's important to think about a little bit as we say, well, you know, where are we going and what did we mean before? And in a previous conversation of this format, you know, we discussed this point around, well, you know, if physio is a necessity and we as a community of practice do not take advantage of that and enter immediately, what does it say about us?
Yeah, well, I'd like to add with that, Mike, when I started, as I'd said in my little bio at the beginning, is I did a lot of work in hospitals. So respiratory work is, the uncomfortable cousin that we don't want to talk to. And yet, what's this whole pandemic is about a respiratory illness. And I don't think we ever want to forget that when we're treating somebody, we treat the whole person, and we need to talk about breathing. We need to talk about how they clear their sputum, how they have an effective cough, and how, cardiovascular, cardiopulmonary health is as important, you could say more important, than musculoskeletal. So if we don't incorporate that, we're kind of missing the point. And we're also missing an avenue where we can do more, and where we can take the profession to being more of a priority.
I can see, I don't know if you know Diana Hopkins-Rosseel, who's a cardiorespiratory specialist, physiotherapist in Canada. And I can see, she hasn't commented yet, but I can imagine that she has a huge smile on her face after hearing that, because she's been telling us that for years. So thank you.
Well, one of my research for my doctorate was looking at where do students want to go when they graduate? What areas do they want to go in? And this was when I was working in the States, and they mainly want to go into the musculoskeletal area. Whereas, where's our drive going to be in the future? And I did this research a few years ago, and yet our future patients are going to be geriatrics, overweight, obese patients, people with cardiovascular, pulmonary comorbidities. They're the boom of health problems, and yet we're not necessarily teaching our graduates to go into those areas. We're looking at the sexy part of musculoskeletal medicine.
Yeah, true. And working with the All Blacks.
Yeah, exactly. Yeah, working with sports. Hey, I did it for 20 years. I worked with professional rugby, it was good, but it's kind of sad. Is it the most important part of health of a population? Not really.
Yeah, good questions for sure. So I'll go to, I know we're getting close to 8 o'clock here. So we'll ask a couple more questions. So Sandy had another question, and he said, so Jon, you worked at an assessment center. Did many physiotherapists volunteer to work on the front line in hospitals? And was there a call for healthcare workers to help out on the front line? And then he offered a little bit of context. So in some places in Canada, they actually called in the military rather than healthcare workers. And just to add a little bit onto that too, in having the military go in, they were actually the group that called out some of the lack of care or some of the concerns they had in long-term care facilities. So yeah, what do you think about that?
Good questions. And I didn't mention that what the Ministry of Health did was they put out a call at the beginning of the pandemic hitting New Zealand and said any registered health professionals or any trained health professionals that have let their registration lapse, we want to hear from you if you are happy to be part of a surge workforce. And that's what they called it, a surge workforce. They had over 2,000 people register for that on hand. But as you see from our numbers, I think at maximum, we had like 20 in hospital. That was it in total across the country. I don't know whether we had one ventilated patient. We might have had one. So, the government and the Ministry of Health did a really good job of getting things prepared, but it wasn't needed. So, that preparation was there. What was the first part of that question, Phil? Again, I think it was double-barreled.
Yeah, I just said that it was answered. So the first question was, did many physiotherapists volunteer to work on the front line?
All right. So in the front line, in terms of public health, the physiotherapists that work in public health were already there, and they were sort of set up and ready for the pandemic, if you like. And there was a lot of provisioning, and there was a lot of training going on. I listened to an interesting podcast from one of the top doctors saying how to set up ICU, how to teach everyone how to don and doff PPE, that sort of thing. So there was a lot of work being put in the background. All private hospitals' elective surgery was cancelled. So right across Canada, that's all gone. It was only essential stuff that was being done. In terms of in the testing centres, there were a few physios that volunteered to be part of the testing. Yeah, so that I think, you know, we were ready to have it covered should it hit.
Yeah,
we dodged the bullet, if you like.
yeah. Great. Mike, on to you if you want. If we have time for another question, if you think. If not, we can wrap it up.
Yeah, I think we might wrap it up, Phil, and sorry to kind of stop some of the questions here. It's just that's where you get a lot of the great stuff. A few things I wanted to say. One is, Jon, thank you so much. Your experience and the, you know, sharing your experience from the New Zealand perspective, and certainly, you know, even knowing you kind of stepping in and taking a role, non-traditional role for a PT at an assessment site, but as a PT, I mean, the reflections are really rich, and I think, and we all think, that was really the purpose of these what we've called cross-Canada checkups, is really starting to think about how we leverage, how we think about the future from here, and you've helped us understand a little bit of what that might look like. And so thank you so much for your time. While we're here, I want to do a little shout out. I see that Doug Freer has joined us. So for those of you who might not know Doug, he's been in practice up in Barrie, Ontario for 45 years plus, and has been an inspiration for a lot of us, I think, of my generation. So Doug, thanks for being here, my friend. And you know, I almost think that you could get on here and talk a lot about sports and visualization and how to rehab people under very, very difficult scenarios. So welcome. I'm glad you came on today. I'd like to now finish a little bit with where we're going. Phil started off by talking about this is the last of the series of the cross-Canada checkups. Our original intent was really to get a conversation going of where PT physio fits within a bigger, broader perspective inside of this pandemic. It doesn't matter at all, and many of us on this call have different types of experience. It just so happens that Phil and I have experience in disaster management, and we have found it to be quite an experience to be witnessing it here in not just in low and middle income countries, but around the world. And we've learned quite a bit. And I think that all of you who've come on to the show have taught us, Phil and I, huge volumes of perspective. So we would like to thank all of you who've come and joined us over the last number of months. It's not over. We're just ending this particular framework. And so Lisa's here, who is the Chief Operating Officer for the CPA. Lisa, hopefully we can count on you and CPA to kind of send a message out to all of the people who participated about where Phil and I are going. As he said, we are going to continue the Thursday night sessions, which are going to be very much journal club, small group discussions, because we have learned a super amount from that experience too, and hopefully we've contributed to other people's perspectives. But we're about to launch a fairly complicated multi-channel sort of media approach on what physio and health workers experience around the world under emergency and complicated scenarios. And that will probably include a podcast. It'll probably include a series of these kinds of interactive sessions. It probably will include reaching out to some of the giants out there, like Jon, but many others. I just mentioned one will be Alberto Cairo, an ICRC PT in Kabul for about 35, 38 years in Kabul. So there's those who have commitment to the community, and then there's Alberto Cairo. So we're ending this this chapter, but believe us, it's not the end. We're just next. You can, but to all of you who've supported us over the last few months, and thank you to Jon. Phil.
Yeah, I'd just like to echo that. So thank you to Jon for being here and really providing insight and from all your expertise around the world and in New Zealand. So thanks for
A
sharing.
pleasure. Thanks for inviting me.
Yeah.
Hopefully you learned something.
Oh, of course. Yeah.
You're
And
amazing.
yeah, and then I would like to thank everyone for being here today and for being here over the past few months. And I also would like to really thank Jenny Day, she was really when it started becoming professional and the communication got better and the episodes got a lot better. So we owe that to Jenny. And Sean actually said one of his only episode that he said, hey, this was my favorite episode, was the first one that Jenny organized. So I think that says a lot. So yeah, thanks to Jenny as well. So yeah, and thank you to everyone. Thanks again, Jon, and looking forward to the next chapter.
Yeah, well, all the best with beating it in Canada.
Yeah, thank you.
Thank you, Jon. Thanks, everyone.
All right.
Have a
Nice
great
seeing you. Okay, see ya.